Good evening. We begin with the latest on the coronavirus pandemic. The United States is quickly becoming the new epicenter of the global outbreak and now leads the world in confirmed cases. Governors and doctors from New York to Louisiana to Washington State are sounding the alarm about shortages of medical supplies. And joining us is one of the reporters on the front lines of this story, Yasmeen Abutaleb, health policy reporter for the Washington Post. Yasmeen, thanks for being here. What is the significance of the United States surpassing China in terms of the number of cases?
Well, I think it signals, the epicenter of the outbreak has sort of jumped around the world. It was in China, then it was Italy, then it was Europe. Now it seems to be the United States. The number of confirmed deaths from coronavirus in the United States still lags behind Italy and Spain, but of course that could quickly change in the next couple of days. I think it just signals the seriousness of which the United States is and needs to take the outbreak, and that, this is the new epicenter and how quickly it's been able to sort of spread all over the world.
As you look at the map, Yasmeen, where do you see emerging hotspots in the U.S.?
So health experts are concerned about cities you would kind of expect as hotspots, major metropolitan cities with high densities. New Orleans is emerging as a particularly troubling spot. The death rate there is the highest in the country and in the world right now. Boston is emerging as another potential hotspot. Chicago, Miami. So you can see it's sort of quickly making its way around the country and is in those major cities that you would kind of expect to see this type of thing spreading quickly through.
Within those cities, what are the biggest problems for health professionals? We hear a lot about ventilators and their scarcity. Is that the issue, or are there other issues as well?
I think there are a number of issues. There is, a lot of panic over whether there will be enough ventilators to treat the sort of crush of patients that hospitals are beginning to see and expect to see worsen in the coming days and weeks. Not just the ventilators, but the workers who can operate them. That's a specialized skill. Not just any professional can operate a ventilator, so that's also a big concern. And then we're sort of hearing these desperate pleas from healthcare workers about face masks, about gowns, about gloves, about the protective equipment they need. They keep saying, they're essentially being sent to war without protection, without equipment, and equating themselves to that sort of thing.
So many Americans, Yasmeen, have been working from home, trying to stop the spread. When you talk to your top sources in the health community, how successful has the United States been so far in stopping the spread?
I think the United States, the consensus is, of course, has done much better in the last couple of weeks with significant social distancing. There was a poll today that 9 in 10 Americans are practicing social distancing, so that's obviously a great thing. I think there is still, though, some concern that the U.S. has taken sort of a patchwork approach to it. There hasn't been some sort of nationwide 2-week shutdown like you've seen in some other countries, like in Italy or in Spain. There are certain states that have full-on lockdowns and other states that aren't enforcing it quite as much. So it's still not consistent across the country. And I think the fear is in the places where there may be not as stringent requirements that you're going to start seeing the seeds of a big outbreak being planted.
Final question, Yasmeen. When you look at the Food and Drug Administration, which has final approval over any drugs to combat COVID-19, what is the issue you're looking at? What matters in your reporting there?
Well, one thing that we've, obviously observed coming up a lot is the president sort of mentioning these two old anti-malaria drugs called chloroquine and hydrochloroquine as possible treatments for coronavirus. Some doctors are already prescribing them, optimistic that maybe they will have some efficacy. Those drugs are in clinical trials to see if they do work for coronavirus. Because they're already prescribed for another use, doctors can prescribe them for whatever they want. So we're looking to see, how the FDA trials sort of progress on chloroquine, anecdotal reports from doctors who are prescribing it. And there's also another drug called remdesivir that the president has mentioned a couple of times that's also in early clinical trials. But for both of those drugs, it's still pretty early and scant and mixed data. So it's really unclear so far whether they work or not.
Thank you, Yasmeen, for your time and your reporting.